how do you define and measure quality from the consumer standpoint? No one really knows much about that. If you overlay onto that issue the fact that transitions that older people and their loved ones experience in trying to navigate the health care delivery system back home, we know that huge quality problems arise because of bad transitions, and a lot of money is wasted in the Medicare program because of preventable hospitalizations. And it's time to address those problems.
The difficulties around transitions have been occurring for many years, since the time I was a nurse, a brand new nurse, and I was a visiting nurse very shortly after I graduated. And you could see from a person's perspective, from the family caregiver's perspective, that every time a person with chronic conditions or a person who has needs for long-term services and supports, every time they go in a hospital and then come back, they have declined. They rarely come back in better shape. The cycles are just stunning, and each cycle spirals down. So both the individual and the family caregiver gets more frail, more confused, more disrupted.
We're looking for a much more holistic, person-centered outcome that's really focused on quality of life and not just quality of health. So that starts with the individual who needs services, their families and those that they choose to have as caregivers around them, how they define their home, their community. So this isn't about aging in isolation or aging in place in some kind of limited fashion, but it's about living that robust life that we all want to live, no matter what our limitations may be.
What we have now and have had for many years is a provider-centric point of view. Our measures and our measurement is all about that. We have hospital quality measures, we have ambulatory quality measures. Looking at transition measures is very important because you'll capture all of those different aspects of what a person and a family has experienced as opposed to the provider's experience. So, right now, we follow the money. We follow the sort of licensed categories of our system or non-system, however you want to categorize it. By putting the focus more on the individual and sort of the longitudinal experience of a person and those who are taking that journey with them, it really changes how we view the system itself. And until we really get that deep in our brains and in our hearts and in our policy thinking, we're really not going to change things.
I think the important role that the Alliance can play is in actually taking what is occurring within universities and think tanks, the kinds of things that many of our good researchers, for example, at Columbia University have discovered, and make them accessible to people who are actually in need of care. I think the dilemma that we have is so often in the research world, we know exactly what would work and we exactly know how to do it. But the problem then becomes that it doesn't get disseminated down into the grassroots, and we continue to have individuals needing care who have chronic illnesses and their families who struggle year after year with the same inadequate support or without knowing the new interventions that are possible, when in fact we could make life so much better for them. So I think the Long-Term Care Quality Alliance actually could promote the translation of research at the grassroots level, can actually help policymakers as well as program developers at the state and local level begin to access good information and begin to understand how to take the findings that have clearly been found to be useful and put them into action.
Well, here's a group of experts that over time I think will help redefine the measurement system for all of that, so that regardless of where a vulnerable older person or younger person with a disability lives, that people could learn what quality is, how to recognize it, how to recognize preventable problems of any kind, so that people can be as healthy as they can possibly be, even if they have multiple chronic illnesses.
I think that one of the wonderful things that the LTQA does is it's bringing together organizations and individuals from such a broad array, so that you've got the providers in the room, you've got the payers in the room, you've got government officials in the room, you've got families represented, and that there's a shared sense of where we're going. And I think that that makes this work kind of unique.